it's important for us in order to develop program services and address this need to think also about what the research says. And Dr. Manfred, I'd like to now kind of turn it over to you, but you also around the table may have some ideas of some studies that are relevant from Head Start side, from childcare, from homeless or housing and urban development, those kinds of things. So wherever you are, you know, whatever your context is, if you know of some research or some evidence that would bear upon this conversation, I think that would be great for Carolyn and Stacy perhaps to capture that. So I'm going to just kind of ask one global research question because there are three there that we had proposed. So what are the barriers in conducting research in the field, and, you know, how do we know that we're making sound recommendations based on the evidence, and what kind of challenges do you as a researcher have?
Sure.
Okay, got that covered?
Yeah, and I'm gonna answer that by not answering it at first.
Okay. Answer it with another
actually,
question.
I just want to piggyback first on what Don and others have said. One of the things to think about in terms of research is most of the definitions that are used for homelessness are using the ED definition, which does not necessarily mean children living in shelters. This could mean, someone mentioned going over to an aunt or uncle's house, or friends or family or other type of situation. Children in those categories are showing very large deficits, more so than just low income in their academic performance. So it's not just the fact of being in a shelter or a gymnasium. Those things certainly, and they actually will massively exacerbate the effect, but having very little ownership over anything when you're at someone else's house. If you're at an aunt or uncle's anyway, you're going to have most of your things in a trash bag or in a storage unit or something to this effect, or the trunk of your car, if you have a car. So these kind of things are one of the aspects I want to add to it. The reason I think this is important is when you think about research, and almost all the research that's been conducted in the last about 10 years has used that definition, has really used the school districts checkbox sort of if they've qualified to meet homeless services as the definition and the only definition. And that means any time during a given school year they've met that definition, they're in that group. That means, and Stacy sort of alluded to this earlier, someone who experienced homeless one day or 3 months or 6 months or was in a shelter or was at a neighbor's house for a couple of days or something are all being lumped into one thing. And so it's really hard to get down to the matter of what's going on. I will mention this. It seems fairly common across all children who are experiencing homelessness that getting to school is a big issue. Absence are high. And absences are associated with lower school performance. This, of course, it's difficult to learn. It's difficult to perform, and I don't want to overemphasize this, but it's very important. But why perform well in the test? You know, sort of a who cares? I don't really I have all these other stresses in my life. Why do I necessarily care about this test? Is going on. So that's one thing in terms of research. The research that occurred earlier in the 90s usually more focused on shelters and children living in shelters. And what they found was that children who were able to show a higher level of self-regulation, self-control, and other aspects of regulation seemed to be far more resilient in overcoming the adversities associated with homelessness. And that was a big part of it. Sort of, if you imagine navigating all of these different situations, navigating changing of teachers, changing of homes, changing of stress levels, and things like this. So that seems to be a promising area. But again, there's probably 1 or 2 research studies that have actually looked at this closely. As far as related to, and I tend to focus more on the learning side of things, there's really only one, and it was a while ago and not very well done, really, project looking at the effect of early education programs. Someone mentioned school climate earlier and sort of getting into, I think it was Don, getting into the feeling that this is a good place, a safe place, a secure place. There's really, that needs to, I think, be explored very much deeper, and then how that connects back. To answer your question very briefly, with barriers, I think there is multiple levels. It comes down to a family who's a family who is experiencing homelessness who has to say, yeah, I'm interested in taking some of my time away from finding work, away from finding shelter, away from meeting those physiological needs of my family, to be a participant in your study, to fill out these surveys, to have my child answer these questions. That's a very difficult thing. this goes up and up to various levels, but I think, just to sort of round this out, this is a personal perspective. I think if research were more tied with actual programs, and be it training programs or be it support programs, these kind of partnership programs, that could look at the obstacles related to learning or the obstacles related to other things that are affecting children and families experiencing homelessness, and then at the same time follow the effectiveness of how the programs are helping those children. So how might a family who reaches out to a specific service that has, and I'm just borrowing someone's word here, but bundled things together, how might that actually help them progress maybe more quickly or in a different path or trajectory towards feeling a little bit more secure and a little bit more good about getting out of this adverse situation and getting back to a situation where we are able to serve our children and live well and meet those physiological needs.
So I just want to interject my question here about, just to clarify. So if the research questions, if you will, the study was tied directly to a program or a service, you think that could be of benefit? Okay.
I do. I think that's one of the big things, and I've been writing down different names and different things here, but I really do. I think that's such a big part of this, because you can learn about the families while helping the families, learn about the children while helping the children. And I think that can go back and sort of impact maybe broad policy or broad ways of organizing partnerships and things. If you can show that having, again, a bundled service or a place where a family can go that is looking for help with, let's say, shelter, and find that there's all these other resources at the same time to sort of ease the burden of I have a 3-year-old and a 6-year-old and an 8-year-old, and I have all these other obstacles. You can really show how collectively the family's doing better, but also learn more about that and how other maybe broad policies and programs can work together to promote overcoming the adversities related to homelessness.
So he wants work to do. He wants data.
After July.
Well, this for me has been very rich, and I hope that you all feel like you had an opportunity to participate. Alyssa, I didn't know if you had any additional comments around successful partnerships or obstacles at this point that you'd like to share?
I mean, just listening to what everybody else has been saying, I know this talked a little bit about continuum of cares. And in our state, we have 8 continuum of cares who are diligently working to get their coordinated entry in place to better facilitate a more robust and comprehensive process for bundling these services that we've been talking about. And I think that any of the service providers, if you're not already participating in your local continuum of care, that's the first area to start overcoming some of these obstacles that we've heard about, and also to develop these partnerships that will be effective in addressing homelessness among youth and families and children from the very beginning. So definitely get involved with your continuum of cares.
So there you heard it straight from her. Get involved, get involved. Well, those of you who are observing and have been very actively listening, I just want to say thank you to you. So we can give you a round of applause here. And we'll want to hear more from you in just a minute. But let's give a round of applause for our roundtable participants. I just think it's been a very rich discussion. But I have to admit that as a facilitator, I feel like we've only scratched the surface on some of these things, which is so, it's just kind of the way life works when you're working with young children and families that have high needs and at risk for homelessness. So at this point, we're going to just, everybody take a deep breath and kind of reflect on the conversation that's occurred in the last hour and a half. And what I'd like for you to do is to just share your general reflections. First of all, how are you feeling? Are you feeling like, well, there's promise here with these people at the table, we're talking together, or oh my gosh, it's just so overwhelming? I mean, just if you can be as transparent as possible, I think that really does help lend to potential next steps. And that's really what we're trying to kind of capture now. Is there a next step to this conversation? What would you see in that? So general reflections from anybody in the room. And Carolyn's going to be passing the microphone around so that we make sure that we capture this on the videotaping as well. Any of you from the council meeting today that would have some general reactions to the conversation?
Well, while you're thinking, I'm going to go ahead and start.
Thank
As
you.
Eleanor just said, as far as next steps, as I'm listening to this, I am so eager to get back to the office and talk with Stacy as far as next steps, because I don't want this just to end here today. I can see this, first of all, as being a model for other things that will happen. I am thoroughly energized, and so I'm looking forward to having conversations with the Governor's Committee to End Homelessness, with other partners that are at the table, as well as the Head Start Council. And so I'm just looking forward to thoughts around next steps. So, yes.
I'm thankful Alyssa mentioned at the end about the continuum of care, because that's something I had noted on. At one point in time, I went to a meeting about continuum of care, but it seems like they are so spread out, especially in rural areas, to be able to connect with them has been difficult from my perspective.
Where are you? Sorry, where are you located at?
Marshall area.
Marshall. So the balance of state, I briefly mentioned that earlier. Missouri Housing Development Commission does act kind of as the lead agency for the balance. And so we do throughout the year have 4 different regional housing team meetings, which it operates a little bit differently than some of the other larger continuums. But definitely after this, I can get you my contact information. And what we really have tried to round out the regional housing team meetings to do is try to make sure that, since we are covering such a large area, 101 counties, and those then are broken into 10 different regions, we want to make sure that whatever location that we have these in is centralized for people from all over the region to come to. And we like to give notice ahead of time, so I can definitely get you that contact information. One of the things, kind of just to go off of that, even in balance of state, regional housing team meetings, and even in larger metro meetings, something that's maybe not talked about as much is unmet needs. And so by bringing your thoughts and conversations around youth homelessness and early childhood homelessness to those meetings to address where you guys are not receiving supports or don't feel like you have proper funding or anything else, bring those conversations to those continuum meetings and your regional housing team meetings if you're in a rural area. So that way the conversation continues from this meeting and moves forward, and you can start finding solutions to those very specific topics that you guys are looking to get answers to.
Okay, so you're kind of an avenue, a vehicle, making sure that people get to those regional housing teams and partner with their COCs. So address some of the obstacles or just the needs.
Yeah, so we do a lot of the different things. I think somebody brought up needs assessment a little bit earlier. Every continuum, as far as my knowledge is in the state of Missouri, has a needs assessment, and so for the balance of state, we specifically have that also, and we definitely always look for information on how to make our regional housing team meetings directed to that specific part of the state. Also, I'm a vehicle, so if you need contact information for other COC leads, I'm more than able to get you connected to that. And also Dottie with the Governor's Committee would probably be very interested in get you connected to the different COC leads across the state.
Great. Carolyn?
Eleanor, I have 2 things. One, I'm going to hand the mic over to Jennifer. Jennifer is also on the Governor's Committee to End Homelessness, and so I'm going to have her speak for a moment. And while I'm giving her the mic, I have a question for the panel. I had a question asked about human trafficking and how that ties in to this issue.
Very good question. How does human trafficking?
I can take that one if you'd like. We have seen some human trafficking in the K-12 districts, and probably, I don't know how many of you are familiar with some of the western part of the state, but they are very active in that part of the state as far as bringing traffickers to trial and then getting sentencing for those traffickers. We've found trafficking in K-12 populations, unfortunately. There's a group in Columbia that are pretty active with trafficking, that do a lot of work with K-12 students. So it does play into our population of homelessness. They're a very vulnerable population of students. Sometimes we see that they just need additional questions asked when they're coming into the school about, you know, how they've been trafficked. And so we're seeing a lot of changes in legislation and laws as far as how trafficked students are then prosecuted under the law. Previously, you might have had a student who might have come in and then, you know, they were caught maybe prostituting, and so automatically they were put into the judicial system, when in reality their only crime was that they were homeless and that this is how they supported themselves. So we are seeing some changes there. So while it's an awful thing to think of, and to think that in the 21st century that we actually have to think about this now, the training that I've gone to, the best way that I can probably put it into an analogy is that if I'm a drug dealer, I buy a product, I buy so much of that, and then I distribute that product, get my profit, and then I have to start all over again. I have to buy new product, I have to put it out there, and I have to start over again. But with a human, I can buy that human or take that human one time, and I can traffic that human as many times as I want to. And it's a resource that doesn't end for a long, long time. So, I mean, we have to be cognitive of the fact that when our students come in and we're asking these questions and they may appear to be homeless, or maybe some questions that we've got aren't being answered, it's okay to enroll that student, put them in a classroom where they're safe, and then kind of do some backstory, just in case we have somebody who is being trafficked. But unfortunately, it is part of our world, and so it is something as enrollment personnel they have to be cognitive of.
Yeah, that's really a sad commentary on
It is. It's very sad.
society. It really is. Vulnerable people being exploited in that way. And maybe they'd be a partner that you might consider coming to this kind of discussion too. Not, you know, the human trafficking advocates to address that.
That's
Yes.
a perfect
Jennifer, is that
segue.
right?
So my name's Jennifer Carter-Dockler. I'm the Public Policy Coordinator for the Missouri Coalition Against Domestic and Sexual Violence, and I'm also the Vice Chair on the Governor's Committee on Homelessness. So we represent all the domestic violence shelters and rape crisis centers in the state. Currently, there's not a separate human trafficking statewide coalition, so our organization has been very involved with the human trafficking task force meetings that have been occurring, and helped organize the first ever Sex Trafficking Awareness Month event last month on January 26th. So kind of tying into some other comments that were made earlier, I think we all tend to have our lens and our perspective. And so for me, coming in, listening to an hour and a half talking about families who are homeless, I'm thinking many of them are probably experiencing intimate partner violence. And so where is that a part of the conversation, or just general victimization and trauma histories? I've also been thinking about a large part of my job is I attend a lot of meetings and trying to figure out then how to bring everyone together, because I'm on the Early Comprehensive Childhood Board, I'm on the Governor's Committee on Homelessness. I've went to the Sex Trafficking Awareness event, and there's a lot of similar conversations happening in a variety of places, and so trying to figure out what is the best venue to connect everyone, because I'm hearing a lot of similar things happening in a lot of different meetings. And so even at a statewide level, trying to figure out what is the best way to bring all of those conversations together so that they don't continue to be siloed. Because if we're doing it at a statewide level, it's happening at a local community.
Sounds like there are a lot of like-minded people here, Jennifer, that you may connect with over time, and because that's a big question. How can you get all relevant people together to address this? So.
I think Donna has an idea.
No, I think I don't. Carolyn and Tracy and I have talked probably for 3, maybe 4 years about a homeless conference, and we've batted that idea around. How do we make it happen? And then it kind of dies down a little bit, and then we talk about it some more, and then dies down a little bit. But I think that what you're alluding to is that that's something that a lot of states do.
We do. We do. Yes, MHDC has an annual homeless.
But I think something that brings all of us in together.
Well, we do have that, but it's getting the word out, and we've tried to get it out to the McKinney. When we keep getting every year more and more McKinney-Vento representatives that come, and I was just writing down to give Dottie a note. They are some of the most enthusiastic attendees because there's so many topics. Dr. Manfred spoke, was our lead speaker last year or 2 years ago or something, and it offers so many opportunities to learn, and especially for people who are in different fields that don't spend all their time on homelessness, and maybe it's on education, but then they have these problems that come up, and it's really nice. But I'm glad you're enthusiastic about it. Maybe you can come this year.
So
I wanted to just add one quick comment to tie it together. I know Jennifer was saying, what's the common tie? I think a lot of the movement toward trauma-informed education for practitioners is key, because the only way we hear the stories is to be willing to take the time to listen and let it unfold. Folks who are vulnerable don't just put it out there. It's layers of information, and it's identifying those folks that we know are vulnerable and allowing the time and the opportunity for that story to unfold for us to figure out how to best address their needs.
So when you say the story, every one of us sitting here today has a personal story. And we may know someone who's experienced homelessness, either short-term or long-term. We may know school personnel who are struggling and frustrated because of maybe just the lack of the capacity within the district and all the partners to have the time to focus on this issue. So the story, I think, could also benefit what Dr. Manfra was talking about in terms of capturing some information, and helping to inform strategies that would really work. How would you capture the stories?
Just, what came to me initially, and maybe it's not, I'll just say it. So I think part of the way to capture a story would be to include families as a part of the discussion. So I understand, certainly homelessness, it is a very sensitive topic. And so I would certainly respect that sensitivity. But I also do believe that there are family members that have been in homelessness, perhaps are not homeless right now, but want to be a part of that discussion. And so in order for us to best address those needs and to capture those stories, they should be included in the discussion.
And really make it more family-centered, is that what
Yes.
you would say? Okay. Yes, sir.
Capturing the stories, but then getting the people a few short miles away from here that can help us with this situation. I guess that's my question. Is there an advocacy group that really can have an impact with that group of folks just a few short miles from here? We all know last year a law was passed that basically knocked about 6,000 children off the safety net by limiting TANF results. I know so many of you and respect the work that you're doing, and yet I know there's a group a very short distance from here that don't make your jobs any easier. I'm just curious how we advocate with the people that have the resources to let us do more.
Okay.
So I'll speak to that. That's definitely a focus of ours. And I was looking at Jennifer right when that came in. We worked very closely with her organization, her executive director, and a significant number of other advocates, especially when the reform came for the temporary assistance for needy families bill last year. However, it continues to be difficult conversations when we are talking about funding. And I had lots of notes down here when obstacles, it was policies, budget cuts, lots of those. So I think it does take a concerted effort, a unified voice in terms of what are priorities, educating about realities and barriers. But it absolutely has to be a big part of changing policies, perceptions, and funding.
And I'm just curious how we get that unified voice, because I know a lot of you worked very hard to try to prevent that from happening last year. Still, it happened. And
I think, you raised just it's a huge and important point, especially the word unified. So that's where my mind is drawn to, because as you know, Dr. Jensen, and it's partnering with champions like yourself who are, in addition to the organizational advocacy folks, but it's how do we have, in early childhood, we all know it's fragmented. It's fragmented. But we work our hardest to make sure that we are all trying to get to the same table and trying to have that unified voice. It's extremely difficult. We need to do a better job at it. And, I'm going to be real here. I mean, there's turf issues at times. And so, again, how do we become unified, put the kids and the families in the center of the table, let the chips fall, and move forward? So when you're able to answer that question, because I know you're working on it, I know. Boy, that's an important unified message. We don't want to further confuse the issue and create further miscommunication, perhaps mistrust. And so the unified approach is key.
Thank you. Anyone else? Reflections?
Well, I might say, if you're able to do get the unified voice pulled together, I do think in terms of approaching the legislators and the policymakers, getting at the economics of it is that, Jennifer mentioned the human sex trafficking and things like that. A lot of the domestic human sex trafficking that happens in the United States, including here in Missouri, is from runaways, kids aging out of foster care that have no other means of support. But if you look at those kids' history, there's usually a lot of trauma, a lot of just really bad stuff that has happened to them in their lifetime. And I do think that's kind of tying it back to the early care and education and supporting families with very young children, is that the more work we can do with them when they're a young family, the better off we are as a community, and it saves a ton of money. If you can prevent trauma in early childhood, you may be preventing, they're more ready to learn when they go to school. There's less chance of them becoming involved with the juvenile justice or adult correctional systems. They're less likely to need intense mental health services and have other health issues, as we know about the adverse childhood experiences study that Kaiser Permanente did. So I do think, as far as the folks that control the purse strings, there's some very sound economics to quality early care and education and family supports, and it's worth investing in. So again, the unified voice is probably your first challenge, though. So.
And it's
great
big.
Thoughts. So you've all heard about the James Heckman study and the economic impact of early childhood, that kind of thing, and the Head Start impact study is another resource that may be helpful. Those are just things off the top of my head, and boy, how I wish we had another 2-3 hours. We'd have a break. But a lot more time to continue this discussion. And I sincerely hope that you will continue this dialogue wherever you go back to this afternoon or tomorrow or next week or next month. And I don't know if Stacy or Carolyn have some, I know Carolyn has some final comments, but I want to point out too here, just keep in mind, again, referring back to this resource that's on your flash drive, but the harmful effects on the development of young children, especially, of homelessness. A higher prevalence of physical disabilities, developmental delays, emotional mental health problems, and behavioral issues. stress levels that are so high with this ongoing stressor that they face that it actually creates what we call the toxic stress in that child, increased levels of cortisol, all kinds of things that can impact them physically and nutritionally. Little or no positive interaction with adults. If you're a mom or a dad and you're worried about where your next bed is, or where your next meal is coming from, it's really hard to focus on your child's developmental needs. And that collaboration really is an important aspect of this dialogue, as you've all heard. The resource also says, this is according to the North Central Regional Education Laboratory, comprehensive partnerships begin because individuals, like yourself, reach out to like-minded people and groups to address those issues that affect children and their families. So I just want to say a personal thank you for your attention, your time, being here today. I know you had a little iffy weather yesterday, so certainly appreciate your interaction. And if you have final thoughts, questions, comments, please bring them up to me, and I'll try to make sure that the handoff, I liked your warm handoff. I'll give a warm handoff to Carolyn so that if there's any kind of follow-up, she will be in charge of that. Thank you very much.